Justin, would you like to introduce yourself?
Hi, I'm Justin. I'm a small animal veterinarian. I've studied in the University of Glasgow, and I've been working in the UK for the last 4 years now. Originally from Singapore, so I've grown up and done quite a lot of work experience in Singapore prior to becoming a vet and while in university as well. I've worked in places like the zoo, clinics like Monster Pet Vet, Point Veterinary Surgery, Stars Veterinary Clinic. There are a few others, but I really can't remember. I've got 2 cats, so I'll show you my cats. Yeah, oh, that's me.
Oh,
So this is Miko.
he just flew.
Don't eat your food.
Okay, so the first question is, how do I know when I'm ready to own a pet? And what are some personal considerations to be made regarding when I should get a pet? How did your parents know when you were ready to get one? Did they ask you questions? Did they tell you to prove yourself in some way? Because I had to prove myself.
I woke up, I think it was after the December exams. And then my dad was just like, you want to go down to the SPCA? And I said, yeah, sure, why not? I'm really bored. Then we just went out to see some dogs. And then there was one that really resonated with me. And then he was like, yeah, maybe we'll come down next week to get a dog. And I was like, okay, why not?
Yeah, but the thing is, he didn't ask you anything. Is it because he had experience as well? So just in case you didn't know how to take care of one, he could. Is that why you can, your parents are more trusting of you to get a pet?
Yeah, I guess because my dad also grew up with dogs, and our family is quite a dog affiliated family, so we just have quite a lot of experience, and I don't think it was ever considered a huge hurdle or responsibility. It was just oh, we're always going to have dogs in the family. It's time for you to have a dog because you like dogs. I think the politically correct answer to your question is it's probably more about taking responsibility, right? You feel responsible in having to look after the pet that you're going to get, to exercise daily, if you're going to get a dog, or clean out the litter tray daily if you're going to get a cat. It's I guess you'll never really know until you actually have the pet, but you also need to have these considerations in mind.
So the next question is, where can I get a pet? What's the difference between adoption and buying a pet? Is there a pro and con? Pros and cons, yeah.
So I got my pet when I went to the SPCA. I haven't spent, the last 8 years in Singapore really, so I'm not too familiar with where you can actually get pets in Singapore. But as a general overview, you can either buy or adopt. If you're buying, you've probably got a choice between licensed breeders, hobby breeders, and just run-of-the-mill, my dog or cat got pregnant. Run-of-the-mill. Yeah, I let my cat out. She came back pregnant. I'm just trying to sell these to make a quick buck. I think within that subgroup, there are pros and cons. A lot of it does come down to money. If you want to get one from a licensed breeder, because they've had to become licensed, there are very strict regulations around that and how they breed the dogs, what tests they have to go for, vet bills as well. So you're gonna get what potentially maybe a more well looked after pet, but it also comes with its associated price tag. It's not to say that you're going to get a better quality dog. I think that's probably one pitfall a lot of people run into. Just because you're paying more doesn't mean that the dog's inherently of a higher quality, nor is it worth more. I do know quite a few hobby breeders who probably take better care of the pets, or even amateur breeders who take better care of the puppies or kittens or the babies better than licensed breeders. So that's one category. And then you've got adoption. So I think there's quite a big push to adopt your pets because it's a more sustainable thing to do, which, yeah, that's quite a logical stance. I think the downsides to it are a lot of times you are going to get an older pet. So you might run into difficulties a lot of times there are reasons why the pet's being put up for adoption, and it's not always the family or whoever adopted the pets side of things. Sometimes it can be animal side issues. I think therein lies your difficulty. Also, I think, and this may be specifically UK, although I vaguely remember something similar in Singapore. There are quite strict guidelines for potential adopters in the UK. So you need to be like assessed for having an appropriate home environment. So the longest time, Claire and I, we were trying to get a cat, try to adopt a cat, but they kept saying, "Oh, you can't because you live in a flat or a second story flat, and all these cats need outdoor access," which is
they do that in Singapore. Yeah, with the Save Our Street Cats Foundation. They like went to my mom's friend's house and they made sure she meshed up everything before letting her have the cat. So yeah. But I don't think SPCA does that. SPCA, you can actually get the pet on the spot. That's what I was told. But that's not reliable information because that's a few years back. So yeah. How do you know what pet suits me? It's kind of like the first one. It's like, how do you know what, So this is about like, could you share the type of pets that require the least maintenance and the most maintenance so the viewers know what can suit them?
I guess you've got your general too, like that 80% of people will have in Singapore. So you're gonna get cats and dogs, right? There will be a small minority that get your small mammals like hamsters or fish. So I had fish when I was growing up. You can get reptiles as well. So I'm really not too familiar with those. In the UK, number 3 and 4 on like the most popular pets are rabbits and chickens respectively. So yeah, I think rabbits are gaining popularity.
In Singapore as well. And chickens, maybe. So I know some chicken owners, so
it's hard to say really. A lot of it comes down to your personality. I think I'll just focus on cats and dogs because there's really too many to cover if we do everything. So as a very, very general rule, if you kind of have the personality of just being more chill, you're not really the type to like want to go out daily to exercise or go for walks, and you just want like a little friendly fur buddy, then cats are probably your best bet. Whereas if you're the type that probably likes to exercise more, likes to go out for walks, likes to meet different people, then yeah, probably dogs are what you're looking for.
Okay, so are there certain breeds of cats or dogs that have specific care requirements?
I guess from the healthcare standpoint, yeah, there are a lot of breed-specific health issues. Maybe as a general thing, so I guess what's becoming quite popular here in the UK are these flat-nosed dogs. Well, they've been popular for ages, but they're becoming even more popular for whatever reason. So French bulldogs are probably one of the more popular breeds nowadays. And you get a lot of associated health issues because their face, or their skull's meant to be about maybe this long, and through like selective breeding, breeders have squashed their faces down into like a third of the size. So you can imagine they literally can't breathe. That's why owners always say, "Oh yeah, he snores and that's normal," but it's not really. Like he's literally dying every time he goes to sleep.
What about like in Singapore, the most popular pet breeds I think are like Maltipoos, those small toy poodles. Are there any like associated like health risks as well? Or
if
no?
I remember correctly, in Singapore, a lot of the health issues I saw were to do with skin issues, but that's also partly due to the humidity and the heat.
Could you name some?
Oh, okay. So for example, you've met Milo, right? My weird looking beagle.
Yes.
Yeah. So he has chronic yeast infections in his toes and his ears, and these never go away. So it's a huge pain to deal with. But also it's common as well. It is difficult to deal with because it's so hot Imagine like this hot, sweltering environment. These dogs have long ears as well, and they're closed over. It's the perfect environment for yeast and bacteria to thrive. So they just love growing there. And it is more common in these small breeds as well, seeing skin issues. So I think if you do see something, go see a vet for sure, because there are a lot of options out there.
Okay. And for cats, are there any health issues? Because my cat has a flat face and I kind of feel really scared now.
So I think flat-faced cats, they're not as overbred as dogs. So they'll do suffer from similar issues, because actually their face or their skull shouldn't be as narrow or as short, but it's just been selected for through years and years of breeding. But yeah, they don't suffer as much as dogs for sure. I think the main issues that I see with cats probably are to do with how they're housed. So because in Singapore, it's quite limited space-wise. So if you've, for example, got an outdoor cat, it's quite a high chance that if it's let outdoors, it's immediately gonna come out to a road rather than a field. And then you have to think about, is my area in a high traffic area? Because if it is, then you're quite a high risk of getting into a road traffic accident, or the cat is rather. Brother's cat, I think he ran away. He was away for about 2 or 3 months. He didn't come back.
Oh.
But he was fine in the end. He came back after.
He did come back. Oh. So for like the flat-faced dogs you're talking about, how in any case someone has them or wants to get them, what do you advise? Like, do you have to clean their faces or something? Apparently, that's how you do it.
Yeah. So I guess I could go on and on about this. I think your best bet is to go see a vet, but just know that they're really not meant to survive. Like if you had a pug and it's gonna sound really controversial, because I've got a lot of friends with pugs, but if you had a pug and like the apocalypse happened and all humans got wiped off the face of the planet, pugs wouldn't survive for sure. They'd be to go. Whereas like your run-of-the-mill, I don't know, like Labrador, he's got a bit more of a chance.
Or like the street dogs have more of a chance than a pug.
Yeah, exactly.
With the rise in popularity of backyard breeders, could you share the health risks that a pet bought from a backyard breeder may face?
So I take it backyard breeders are either hobby breeders or amateur breeders. So I guess health-wise, again, I'm not sure if there are legislative requirements for even licensed breeders in Singapore, but generally for all puppies, there are really important health checks they should be going through. Sorry, puppies or kittens, there are really important health checks they should be going through as they're growing up. So first, when they're initially born, you want to make sure that they don't have developmental defects, because that's really not compatible with like a good quality of life or even life in general. So again, I can't speak for all backyard breeders, but I imagine most of them either aren't aware of that health risk or they just don't really care. But they should probably be going to a vet at certain stages in that pet's, or while that developmental stage is ongoing. In terms of preventative healthcare, vaccination is really important. Getting intestinal worming products as well. So all puppies and most kittens are just born with intestinal worms, and they need to be dewormed as they're growing up. And like a really horrible thought is these worms are transmissible to humans. So if you ever want to see something horrible, just look up intestinal worms, animals transmitted to human eyeball, and you'll see them like floating in the eye. So worm your pets, guys. Really importantly, I think aside from the health point of view, there's socialization. So there's a very narrow window. I can't remember the exact ages, but from the time they're maybe about 1 to 3 months old for both puppies and kittens, where they're very receptive to new ideas. very receptive to training, very receptive to meeting new people. This period is called socialization. So if you compare a breeder who's really experienced and knows like, okay, I need to socialize this puppy or kitten before I get them to the new owner, because if not, I'm gonna give this new owner a really hard time rearing this puppy or kitten or this dog or cat. And again, if you're less experienced or you're not really aware of this socialization period, you might just say like, okay, you know, these are like dogs and cats, they survive for years, I'm just going to put them in one corner and that's fine, but it's not really.
Okay, so like the outcome of not socializing your pet, is it like a pet with behavioral issues that are really aggressive?
Yeah, so you've probably seen it before. I mean, it's not the only factor that goes into determining the behavior, but like you've probably all seen like these like really horrible dogs who just stand in a corner and like snarl at everyone, or these cats who like if you go near they hiss and swipe at you, and then you compare it to other dogs who are like the friendliest thing ever, right? They'll come up to you, like shake your hand, ask for treats. A lot of what goes into creating that friendly dog, and I suppose that's the ideal behavior that we're all aiming for, is the early socialization process.
So like there are certain breeds of cats and dogs that may be prone to like more diseases, like the Cocker Spaniel. Do you know any breeds that will require more like care because of like, and like you obviously have to bring them to the vet more because they have more diseases, so that's more money?
Probably the main ones we see with the most health issues are the flat-nosed dogs, so pugs, French bulldogs, but that's also mirrored with the rise in popularity. So there just are more of those breeds out there, really. Cocker Spaniels, what do I see cases of? I tend to see them with a lot of skin issues and ear infections generally. As a slight offshoot of that, you can get Cavaliers, so King Charles Cavaliers, and they're really prone to heart issues. Funnily enough, so I think when I was in university, like the main breed that keeps cropping up as one that has a lot of health issues is a German Shepherd. They've got like a wide array of health issues affecting multiple body systems. But yeah, in general, I think you can go onto a lot of breed-specific websites for information if you are thinking about getting a specific breed, or I'm sure if you phone a practice or send an email in and say like, oh, I'm thinking of getting a Cocker Spaniel, for example, and they can direct you towards like good information.
Is there anything for like cats or nothing?
Yeah,
really?
so there's the equivalent. With cats, there are certain, again, breed issues, like, for example, Devon Rexes are more prone to specific heart conditions again. But again, I mean, it's the same advice really. Like, if you are considering getting a specific breed, maybe speak to a vet that you've got a relationship with, or look up some websites. But there's a lot of information out there, and it can be quite hard to tell really sometimes what's legit and not.
I would like to bring up hip dysplasia. Isn't it really common for big dogs?
The hips, it is a joint that connects your pelvis to the next long bone in your lower leg. So it's really important for mobility, because a large proportion of a dog or cat's weight, even though they're four-legged, is still borne on their back legs or their hind legs, as we say, which means that the hip joint is a major joint that's going to be prone to a lot of issues with both overbreeding as well as overfeeding, I would say, and inappropriate exercise. We've now come to a point where hip dysplasia is a really, really common condition. So hip dysplasia is where the hip joint just isn't sitting quite right. It's a ball and socket joint. So this is the ball and this is the socket. And if there's hip dysplasia, what can happen is that the ball can shift and have these micro movements within that socket. And over time, that'll get looser because you can imagine a continued motion in that area, right? And also that will lead to the development of another condition, which is usually the one that's really, really painful and the one that we see, or at least I see a lot of patients for, which is called osteoarthritis, which is in broad terms inflammation in the joint.
So there's no way to heal that.
Yeah, good question. So as of now, we don't really have a cure for osteoarthritis medically, or hip dysplasia really. There is surgery that can be done. There are various surgical procedures. I guess what you could do would be to replace the hip in its entirety with a metallic replacement. It's a very expensive procedure. You need quite a specialized surgeon to do it. I'm not even sure if there's anyone in Singapore that does them. And it's also associated with a lot of risks, both during the operation as well as post-operatively. So it's not really something I'd suggest doing for every dog with a hint of hip dysplasia. Not even ones with marked hip dysplasia. It's something you really need to have quite an in-depth discussion with your vet about.
The expenses yearly, how much do you think you have to put aside when buying a pet? Like how much would it cost, excluding buying the pet also? Like, you know, like the surgeries and all the shops and all that. Yeah.
I don't really know about Singapore because my parents just pay for all the food and vet bills usually, but at least here, so I think the main things to consider are you've got vet bills, you've got food, you've got grooming for most of them, and I don't know if it's as widespread here. If it's as widespread in Singapore, but also getting pet insurance. Those are all like my substantial, or the substantial running costs for having my cats. Of which I would say the biggest proportion probably are your vet bills. So Merlin, my older cat, he recently had to go to a vet hospital, and the vet bill came up to about £2,000, which is about 4,000 Singapore dollars, for fairly intensive management of, because he wasn't peeing. But anyway, I would say, so when you start talking about vet bills and having emergencies, it's quite hard to have a single cost or a running cost to help spread it out. That's why I do strongly recommend getting insurance if it is available, because at least you can then have that pot to use in emergencies like that. Because I imagine not a lot of people will have, thousands just lying around really, especially if you're, well, at my stage, early working professional.
So what about like the cost of vaccines approximately? Because pets usually need quite a lot of vaccines.
There really isn't like one single vaccine regime that everyone follows. Everyone's got their different ideas. It probably shouldn't be the case, but it is what it is really. I'm really struggling to remember how much it was in Singapore. But in the UK, what's been happening, and I imagine it probably will come to Singapore at some point, is we've been creating these health plans. So every month you pay, say, like $30, for example, and you just pay that regardless of whether you come in or not. And you get vaccines included. And you get health checks and like nursing checks as well. So it's quite a useful way to both spread out costs, as well as not having like a large chunk of money going in at a certain point, because there's going to be cash flow issues with that really. So it probably averages out to be about, 12 times 30, $360 a year.
What are the type of like health checks like that pets require?
So you've got, I guess how I would think of it is we try to have a systemic body system focused examination. So you work through the different like systems in the body, like your cardiorespiratory system, your lymphatic system, etc. And then the way to then use that in practical terms is through like what we call a nose to tail examination. So I think most vets will follow something similar because that's what we were taught in university. You start at the nose. That will mainly involve the respiratory system, whether you see any discharges or lesions. You go up to the eyes, looking for any like lesions, any lumps or bumps, discharges, any changes on the surface of the eye. You're going to look at the teeth, as you said, so it's really important. A lot of dental diseases aren't really, I think, that well looked after in pets. But having like a really good look at both the teeth and the gums to see if there's any plaque growing on there or whether there's any gingivitis. You go back to underneath your jawline, you've got something called the submandibular lymph node. So that's looking at your lymphatic system. You're going down the body and you want to have a listen to the chest and the heart, have a listen to the abdomen and the throat as well. You want to have a good feel of the abdomen, so that's all your abdominal organs really. So not just your digestive tract, but your pancreas, your liver, your kidneys, your spleen. You want to have a good look at the gonads, or the genitalia, especially if your pet's not, or the pet's not neutered. There are other lymph nodes that you want to have a good feel of as well. I guess for the lay person, it is quite hard to tell if your vet's having a good thorough examination or not, but you probably just have to trust that he or she is really.
Yeah. Then also I would like to add about like what types of vaccinations do like maybe dogs require or cats. Like for example, dogs require like distemper vaccination.
So for dogs, we try to think of like the acronym. So there's DH, PPI, and L. So you've mentioned distemper. The H is something called infectious canine hepatitis. P is a condition called parvovirus, and PI is something called parainfluenza, and L is something called leptospirosis. I like to think of them as a group of diseases that a lot of them have been very well controlled with vaccination, so you just don't really see them out there anymore. Whereas like even maybe 10 to 15 years ago, they might have been a bit more of a problem because the vaccinations just weren't that good. But that's why it's still important to keep up with vaccinations, because we just don't really want them to come back, because seeing them, if you've ever seen one of the diseases that we can vaccinate against and people for whatever reason choose not to vaccinate against, the results are horrible really. Yeah, just really horrible.
The acronym, same thing. Is it for cats? Is there one for cats?
Although with the branding, they don't really have like yeah, I'm not sure if there are different brands in Singapore that they get from Australia or whatever, but the big companies that produce these vaccines globally, they don't really have a catchy acronym for cats. Generally what we vaccinate for, still 4 things. So there's 2 causes of cat flu. There's feline panleukopenia virus, and there's also feline leukemia virus. So those are the 4 things.
What about rabies?
Yeah, rabies. Yeah.
Yeah, really good question. So in Singapore and the UK, we're not considered rabies endemic. So we eradicated rabies from the population. So if you're bringing a pet outside of Singapore, or you're bringing someone in to Singapore, you'll have to get them quarantined firstly. And depending on which country you're traveling to, you might need a rabies vaccination. But it's not something we routinely do because it's not necessary.
So So like in your opinion, do you think cats are more high maintenance or dogs? Like when you look at it.
Oh, so yeah, dogs for sure. Like I've owned both. But dogs are definitely more high maintenance.
Yeah.
But that's not to say that cats are no maintenance. Like you still have to put quite a lot in. I think with dogs you do get out of it what you put in. If you're like that outgoing, likes to exercise type of person, you know, having that companion to just go out with, and it also kind of like semi-forces you to go out. It's quite a rewarding experience, really. Whereas cats, I've got this cat called Merlin, and he's just so grumpy sometimes. Like he will try to bite my feet when I'm sleeping, and it's horrible because like I feed him and I clean up his poo, and he still does it. But he's really loving sometimes. And I've also got this new kitten who's really, really loving. Oh, he's really cute. I'll see if he comes. Hold on. Yeah, they're all really food driven, so it's really easy to get them.
Oh my god.
There, that's him.
Wait,
Oh
so
my
fluffy.
god. Oh my
He's
god.
really loving, and like he'll just sit there. Go and jump. Yep. He is a moggy, so he's like just a random mishmash of cats.
Ask about like the different genders of cats and dogs. Like for example, like I think cats, the males tend to be more manja, then the females are a bit more like, how do you describe it? Because my cat is quite like, you know what I mean?
Yeah.
The
At
difference
first, like-
between the genders, yeah.
Okay. Like so from my experience, I think like girl cats. Nico? Go away. I think girl cats are like more, they're more loving, but then they can also like demand their own like independence a bit more. Like
That's
they'll
so
be
true.
like, leave me alone. And then boy cats, they're usually more consistent in their behavior. So for example, we've got like Merlin who just doesn't want to be around me, but then Miko who is now like clamoring to come back on my lap. I don't have any more food. And he always want to come back on my lap.
What essential items are there when you want to buy a cat or a dog? Like, you know, like for cats, you have to like catify everything. You have to put up those things and like the cat tower, you know, those kind of things.
So like a good guideline is to think about what we call the 5 freedoms. So freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, and disease, freedom to express normal and natural behavior, and freedom from fear and distress. So if you kind of work your way down that list, so for example, freedom from hunger and thirst, so you want a food bowl and you also want a water bowl. Freedom to express normal and natural behavior. So as you said, a cat will want to climb and will also want to like scratch. So having like a cat tree is really, really important. And for dogs, it'll be like, they'll want to go explore what's their like hunting territory. So they'll want to go for walks. So you'll need like a collar and lead, right? Or a harness and lead. One really good website is made by the Ohio State University. So if you Google Ohio State University pet guidelines, and they've got like this, I think it's like a single sheet for both cats and dogs. And they kind of go through, this is what we advise you to get, or you to prepare for if you're thinking about getting a dog or a cat.
How do you prepare to take care of a pet? Because you know how some people have different living conditions. Like some people live in apartments, it's a bit more like less space for the pet to thrive, whereas people live in like houses.
I think if you've prepared, if you've again gone through that list and maybe visited the website, you are going to have like practical space restraints depending on how big your living environment is, for sure. Or like if you're living in HDB, like you can't have cats really, can you? If you live on like a really high floor, having a cat, they're quite prone to high-rise syndrome, where they jump out the window. Taking like additional steps to safeguard against that, probably really, really important. But I don't think there's any other additional specific requirements. I'd say have a look at that list, have a look at that website, and then look at your own environment for sure, and then see if there's things you're not sure about. But yeah, vets are really useful sources of information if you've got like really specific questions. They're not just there to answer health related issues. Or even if you can't get a hold of a vet, there are like vet technicians or vet nurses out there who I'm sure will be more than happy to answer your questions. And like online, I think there are a lot of like Facebook groups or forums out there that are mostly vet professionals, and at least you can get some reliable information from them.
Are there any changes to a pet to be cautious about, like behavior or like visible changes? Like how do you know your pet is sick?
Oh, okay. So I think if you've got an inkling that your pet's unwell, because they can't really speak for themselves, right? It can be really hard to interpret if that's a sign of illness or if they're just a bit off. Again, if you're kind of like on the verge of, my pet has vomited once today, should I go in to see a vet? Can always be worth phoning into that vet's reception and then describing the symptoms. And if the receptionist isn't sure, they'll go ask a member of the clinical team. But most receptionists are trained in triaging, so they can like listen to the signs that your cat or dog is displaying, and they'll be able to tell you if you're fine to wait or you need to come in now.
Another question I have, are there like terrible cases, like stories you have of people who didn't vaccinate their animal?
Yeah, so I guess we don't see a lot of them because I think in general, people who don't choose to vaccinate their pets aren't going to want to come to a vet really. Like, it just kind of goes against their whole, I guess, personal philosophy. But I do remember, like, the one that really stuck out to me was this case of parvovirus. So parvovirus is this like really horrible virus that we see in young puppies. They start having horrible bloody diarrhea and blood in their sickness, and they die from vomiting and having diarrhea and losing so much blood and fluid. So it's like a horrible thing because you would see them and then the next minute they would start having diarrhea and vomit, and then like a few hours later they'd be dead. It's very, very transmissible. A puppy has parvovirus and that litter hasn't been vaccinated, or the mom hasn't been vaccinated. So the puppies don't have any antibodies against that virus. It's quite likely that entire litter will have been infected by the virus, even the mom. So you can like lose entire litters that way. Or if everyone's housed in really cramped quarters, then you can lose like entire, I guess, buildings of litters that way as well. So it is quite a horrible disease.
Okay, let's say I have a cat and then I vaccinated it. And what if I vaccinate like the second dose earlier? Does it affect it or anything?
Yeah, it's a good question. I guess everyone kind of knows about antibodies now, right? Because of COVID vaccinations and everything. A key concept here is that with puppies and kittens, they will have antibodies from birth, and they will also get more antibodies through their mother's milk. Especially if that mother has been vaccinated, because she has antibodies running through her, and those antibodies then get transferred through the milk or through the placenta. What then happens is that those antibodies will go down over time, and we need to replace those antibodies with vaccinations. So the reason why we have to vaccinate multiple times is because these antibodies that are already circulating in these puppies and kittens from the mom, we call them maternally derived antibodies. They work at odds to the vaccine or the antibodies that should be created through that vaccine. So you need to have like almost a very specific age where the maternally derived antibodies have gone down to a point where it's just insignificant, and also not going to work at odds with your vaccination. And then you give the vaccination then, or the second vaccination then, whichever. What's the age? Don't really know. It's probably somewhere between 9 to 16 weeks.
So it is important to space it out.
Yeah, it's quite important. You could probably get away with doing like an early one when they're a bit younger, if it's something called a live vaccination. So that means that the vaccine contains like a live organism really, and it'll grow over time. Yeah, it sounds horrible, right? But a lot of our vaccines work that way. But yeah, if you're giving a vaccine with a different types, like a dead vaccine or a killed vaccine, you're gonna need multiple really to get any good protection.
How do you prepare yourself mentally to have a pet?
I don't know if I can speak from experience because I've never had like a mental barrier behind like not having a pet and having a pet, and neither have my parents really. But I suppose you almost just have to, with like any unfamiliar thing in life, right? Like you'll never really know until you try it. The way Claire's Laura's cousin, I guess prepared herself was that she fostered 2 sets of kittens. So she had grown up with a chinchilla, but yeah, those are like weird, low maintenance things. No, I love the chinchillas, but she wanted a cat. So the way that she prepared was she fostered like 2 sets of kittens and like had to get everything ready, and like it was after that where she like really thought like, okay, you know, at this point I'm ready. I've been through this. I don't want to have to just foster and then give up kittens. I want my own.
So thank you for your time. Do you have anything to say to like people, like just a general message or advice?
Yeah, I think it's something I said already. So think of vets as like really useful, reliable information sources. We are really busy, but I think we do go into the profession because we want to help pets in society. It's not just about seeing unwell pets, but also about preventative healthcare and like giving advice. And if you are looking for advice and you're faced with a plethora of, you know, you're not sure if the advice is trustworthy on the internet or whatever, then try and verify it with a vet really. Phone, email, if you know someone, you can text them. Yeah.
Okay, boss. Yeah, I think we can stop recording now.